The patient is a 38-year-old male currently in an acute care hospital. The lead therapist is currently taking a family history as well as relevant health information before beginning his initial assessment. The patient reports being a non-smoker and otherwise healthy before his CVA.
Hi, my name is Franny. I'm going to be your occupational therapist today. Are you Luke? Hi, Luke. I'm just going to verify on your badge your name and your date of birth. And okay, it matches with your chart. So as an occupational therapist, I'm here to help you get back to doing the things that you like to do with your life. And I'm here today to just do an assessment of how your stroke affected your body, and from there we can create a plan on getting you back to doing those things that you enjoy. Does that sound okay? Great.
The occupational therapist uses the patient's phone to show him photographs of his wife to see if he recognizes her. As you can see, the patient is unable to recognize his wife, exhibiting symptoms of prosopagnosia. The patient is shaking his head instead of using verbal confirmation due to thalamic aphasia, which affects his ability to produce meaningful speech.
I'm going to prick each of your hands. Can you let me know if it feels the same or different?
The occupational therapist performs an exam on the patient's sensory perception. She pricks the patient with a sharp object on both sides of the body to see if he can feel it. She asks him to indicate if the sensation is the same or different on the right and left side of the body. She then uses the sharp and dull sides of the object to determine the amount or type of sensation that the patient can feel on his affected side. This particular patient presents with left-sided sensory loss and hemiparesis.
Hi, Luke. Hi, I'm Jackie. I'm your senior physical therapist today. Let me just double check your name is Luke. Okay. So, as a physical therapist today, I will be trying to get back to you to do something functionally, get your movement back to your left side. I know that you did have a stroke. Okay. So, we'll be performing some tests today to see what we can do to help you gain your movement back. So today we're going to test your visual field, okay? So what I'm going to do is I'm going to put my left or right side of my hand coming in front of you, and I want you to tell me which side you see the finger, okay? Alright, start. Side, okay? Side, okay, good.
So as we can see, the physical therapist performs an exam on the patient's visual fields. We tested the visual extinction on double simulation stimulation by having the patient report if they see a finger in a specific quadrant. The patient was unable to see any fingers that we presented on the right side of his visual field.
Alright, so today we'll be testing how your functional motor is, okay? So I want to point to one side and I want you to try to lift that side of your arm or legs, okay?
The physical therapist performed a gross motor exam on the patient to see what the patient can do functionally. We had the patient lift specific sides of his upper extremity and lower extremity. Patient was only able to lift his extremities of the left side with no functional movement on the right side.
Alright, so today we're going to do a repetition set test. So I want you to repeat after me, okay? Dog, cat, car, tree,